Hello again. Tim, the Minnesota firefighter with the armed form of melanoma cancer. My journey began 17 months ago on October 29th of 2018 with a visit to my primary care physician for what I thought was a minor problem. A month later, several diagnostic tests and a biopsy changed my life forever when I learned I had an aggressive and difficult to treat form of cancer. However, my story has been one of blessing and miracles. Those who have followed my journey know that I was fortunate to be referred to the Mayo Clinic in Rochester, Minnesota. I began immunotherapy treatment in December of 2018 and continue receiving infusions of nivolumab once every 4 weeks. It's completely unlike the chemotherapy that many cancer patients receive. My body's handled it well, and my progress has been remarkable. Not everyone battling cancer has been blessed with such an easy and successful journey like mine. Some forms of cancer, like leukemia, can impede the body's ability to produce blood cells. Leukemia, including lymphoblastic leukemia, acute myeloid leukemia, and chronic lymphocytic leukemia, is a cancer of blood-forming tissues, including bone marrow. These types of blood cancers can cause anemia by crowding out blood-producing cells and causing low blood counts. Other cancers can lower blood counts by affecting organs like the spleen and kidneys, which are responsible for keeping cells in the blood. In other cases, effective cancer treatment can create a need for blood transfusions. Chemotherapy can also affect the bone marrow. One of the most common side effects of chemotherapy is low blood cell counts. Regardless of the cause, there are many cancer patients that depend on receiving blood transfusions to increase the number of blood cells and increase the ability of their blood to deliver oxygen to the organs and tissues. Please bear with me as I shift gears slightly. The COVID-19 pandemic has brought substantial changes to our country. Where I live, Minnesota Governor Tim Walz ordered us to stay home for 2 weeks. For most of us that are healthy and at a low risk from the coronavirus, it simply disrupts our day-to-day activities, and it's mostly an inconvenience. However, for our elders and individuals with underlying health concerns, the coronavirus can be devastating. The U.S. Department of Homeland Security issued guidance on the essential critical infrastructure workforce on March 28th of 2020. Functioning critical infrastructure is the utmost importance during the response to COVID-19 for both public health and safety. Homeland Security identifies blood and plasma donors as members of our essential critical infrastructure workers. Did you know that blood donors are considered essential workers, even when states order you to stay home or even use more restrictive measures? Across the United States, the Red Cross and other agencies that collect blood and blood components are facing a critical need for donors. Just recently, the state of Minnesota reported that over 300 blood drives have been canceled and donations are way down. So here's where I circle back. During this time of national emergency, it's pretty clear that doctors, nurses, medics, firefighters, and police officers are on the front line. However, I also know that many people are looking for ways to help. There's one very important way that everyone can be a hero, and that's by becoming a blood donor. The spread of coronavirus doesn't change the fact that many cancer patients require transfusions of red blood cells and platelets. It's a matter of life and death for those individuals that depend on volunteer donors. Blood collection agencies have implemented additional safety precautions to help donors, including the scheduling of individual appointments. Many people, including myself, have repeatedly said, "We're in this together." So here's a chance to step up and be a hero by donating blood.